This conference will now be recorded.
Only 11 of them? Okay, 12. Aisha,
Yes, ma'am.
usually this is the strength, is it?
Yes, ma'am. It's almost 13 to 14.
Okay, fine. I'll just ask other teachers. Okay, we'll start off with the class. So last class we had just started with the filtration and clarification, where we just went through the different definitions like filtration, clarification, cake filtration, what is feed, filter medium, filter cake, what is filtrate, which are different factors that would affect the rate of filtration, right? So moving on to next, filter media. So what exactly is filter media? So filter media is nothing but the medium or the surface upon which solids are retained in the process of filtration. Okay, during the filtration process, medium is a one or the surface which will hold the solids from entering into the filtrate. Okay, so it will retain the solids as such so that solids will not move into the filtrate what we are concerned with. Fine. So there are different filter media. So what are the actual ideal properties of filter media is that this filter media, whichever we are using for separation, it should be chemically inert. What do you mean by chemically inert? Anyone? What do you mean by chemically inert? Answer. Anyone?
The
What do you mean
substance
by
not
yeah?
chemically reactive.
Yeah. So inert in the sense they should be reactive. So they should be non-reactive. So chemically inert in the sense they should be non-reactive. Okay. Then high retention power. That is, they should be able to retain maximum amount of solids with them. Okay. So they should have a high retention power. Sufficient mechanical strength. Say now certain times if we are pouring lot of slurry, that is solids with liquid mixture, they should be able to sustain as such. So they should have a very good mechanical strength and it should retain so much solids as well. So if at all if breakdown happens of the filter media, so in general they should have sufficient mechanical strength so that they retain the solids. Okay, and they should be able to bear a lot of pressure in case if we are applying pressure as well. Then they should be able to absorb negligible amount of material. In general we expect no amount of material should be absorbed, but most of the times there will be very negligible amount of materials that would be absorbed. For example, if we consider filter media as an example, common to common example, if we take it to be filter paper, so what are we expecting is that this filter paper should not absorb any material whatever we are intending to separate. Okay, so in general what happens is that certain times you observe that some amount would get absorbed onto the surface of the filter paper. So you expect a negligible amount or no amount of material to get absorbed onto the surface. Then resistant to the corrosive action of the liquid. There are certain liquids which are corrosive in nature. Chemically they are reactive. In those cases they should be resistant towards the reactive liquids as such. So these are the ideal properties what we are expecting from a filter media as such. So how do we select this filter media? So this filter media, how are we going to select is based on certain parameters. So what are they? Size of the particle to be filtered. So we choose the filter media based on what size of particle we have to filter. Then amount of liquid to be filtered. Say now huge amount of liquid if at all if we have to filter. So we go for a filter which has maximum mechanical strength because the amount of liquid is more. So if when we are pouring they should be able to sustain so much pressure. Then nature of product to be filtered. So whether the product is very viscous or has more solids with them, or it is less viscous. So based on the nature of the product also we choose different filter media. Then purpose of filtration. So what exactly is our purpose of filtration? Whether we are intending to collect the filtrate as such or the solids we are thinking of as a product. So based on these parameters, we are going to select a particular filter media. Is it clear?
Yes, ma'am.
Anybody has any doubt? It could be from the previous class or now till here. Is there any doubt?
No, ma'am.
No, ma'am.
Okay, we'll move ahead.
No, ma'am.
Moving to next, there are different types of filter medias which are available in the market. So they are filter paper, to a name a few: filter paper, oven materials, cotton wool, glass wool, asbestos, craft paper, sintered glass, membrane filters, cartridge units. These are different ones. So we are going to study each in detail, which are used for what reason, what are the advantages, what are disadvantages for each. Okay. So moving on to first, filter media when it comes to filter paper. So as you've seen different filter papers you would have used in your labs as well in your plus 2. So there are different grades of filter paper they are available. So in general it is the most common media, filter media, which people use it for filtration. So you get different grades and qualities of please keep yourself muted. Okay, so there are different grades and qualities of filter paper which are available. So depending upon the pore size of the filter paper, so this is nothing but the filter paper. Based on the pore size present on this, they have been divided into coarse filter paper, medium sized filter paper, and fine filter paper. So coarse in the sense they will have larger pore size, medium, so it will be little smaller than that of the coarse, fine will be very minute pores you'll observe. So based on our intention of retention, that is based on the size of the particle we have to filter, we go for different filter paper. Fine. So high quality, if at all, if you want better filtration, then you expect a high quality filter paper. So high quality filter paper gives you better efficiency or better filtration as such. Okay. So moreover, what happens is that finer is the size of the filter paper, so better is the filtration, as well as there is less tendency to absorb, less tendency for the liquid to get absorbed onto the surface if the pore size is smaller. Okay. What are the disadvantages with filter paper is that they shed very fine particles into the filtrate throughout the filtration. Maybe by the end what happens is that whatever material this is made up of, the filter paper, they start shedding into the filter medium, whatever we are concentrating on the filtrate, as well as tendency to absorb small quantity of liquid is a common thing. Okay. So whatever how much ever quantity we are thinking of filtering it, you observe that some amount at least gets retained on the surface of the filter paper, so they have little retention of the liquid whatever we are intending. So these are certain advantages as well as disadvantages of filter paper. But most commonly we go for filter paper because it is cheaply available compared to others, as well as it is readily available when you compare it with other filter medias whatever we are going to study further. Than those, these are readily available, that is commonly available in market, as well as cheap when compared to others. Okay, this is about filter paper. Moving on to next, oven materials. So this oven materials are such like cloths which are made up of cotton, silk, wool, nylon, or glass. This you would have observed in olden days also. Whenever common in day-to-day life or in household, whatever we use, it is these cloths what we use for different purposes. So moving on to one by one, the woven materials. The most commonly used is the fine muslin cloth. This is the muslin cloth, so which is used for removing the coarse particles whatever are present. If at all, if there are some coarse particles, that is quite larger particle size, if at all, if we have to filter that, then we go for this oven material, that is muslin cloth. So this is the muslin cloth. So this is made up of cotton again. So better for removing of coarse particles, not for fine, because you observe that there is one thing is it gets absorbed, as well as you observe that uh, uh, it can shed the particles into the filtrate as well, and it has great tendency to absorb liquid, and as you see, this can be easily destroyed by some chemicals, right? So these are the disadvantages of muslin cloth. So advantages is that you can use this for removing coarse particle. Disadvantage is that they have absorbing tendency of any liquid whatever you are thinking of filtering, as well as they will shed some particles into the filtrate, because they are of natural origin from cotton. They are generally destroyed by the chemicals, certain chemicals, corrosive chemicals. They can just destroy this material. So that's about muslin cloth. Okay, so this is one of the filter rate as well. So moving on to next, nylon cloth. So this is a nylon cloth. So it's just a example. So you observe lot. So again, this nylon cloth is for coarse filtration only. Whenever the particles are quite larger in size, you can go for this. And when compared to the muslin cloth and normal cotton cloth, nylon cloth are better when compared to these. Um, because they, to some extent, they will not it's not affected by the growth of mounds and all, like unlike in case of muslin cloth. So they are quite resistant to growth of mold, fungus, bacteria. And when compared to muslin cloth and cotton cloth, they have negligible absorption properties. Okay, so they're extremely strong as compared to the cotton cloth when it comes to the tensile strength. So when it comes to the maximum pressure what it can bear, nylon cloth can bear much more pressure than that of the cotton cloth. So hence, when compared to the cotton cloth, people prefer nylon cloth for filtration when compared to this. As well as, in comparison, even to certain extent, it is even resistant to certain chemicals as well. Okay, but not to a greater extent. But when in comparison to muslin cloth, yes, it is much better than that of the muslin cloth. Okay, that's about oven material, muslin cloth and nylon cloth. Again, you have one more known as oven wire cloth. So there is nothing but oven wire cloth, which is, out of the all three, this is the much more resistant ones. They are generally made up of stainless steel, and because they are made up of stainless steel, they are more durable, long lasting. So you can use it for a longer time, and it's for long duration. You observe the, you can use it, as well as it can be cleaned easily. Okay, there is no stain which would remain, whereas in case of muslin cloth and all, there could be a chances of stain remaining on the cloth as such. But here it is easy for washing as well, and easily cleaned and reused again and again. And they are highly resistant to chemicals, and because it's made up of stainless steel, you can even go for sterilization of this, and you can use it for multi-purpose, right? So in comparison to nylon cloth as well as cotton cloth, muslin cloth, woven wire cloth is much more superior and most commonly used filter media when compared to others. Okay, that's about woven wire cloth, or in general woven materials. Moving on to next, cotton wool. So this is a cotton wool, an example as such. So what they do is that this small tuft of cotton wool is placed in the neck of the funnel. All of you would have observed the funnel. So they just keep in the neck of the funnel, and they just keep adding the slurry to it. So this acts as a filter media, and liquid starts passing through it. So main problem is that, as you can see, the surface is not uniform as such. So you observe that these filaments, whatever you see, they detach from the surface of these cotton pads, and they come into the filter medium as such. So they are carried to the filtrate as well. So this is the main disadvantages of cotton wool as such. But or else, it is again most commonly available and most commonly used. Okay, so if at all, if you want a better filtration, you can go for multiple cotton wools like this, and keeping it in one over the other, there is better filtration as well. Okay, moving on to next, glass wool. So this is a glass wool. So glass wool is used for filtering highly corrosive chemicals, okay, or the liquids, or like strong chemicals like acids, alkalis, all these. They are generally used for filtering. These glass wools are used for filtering such corrosive chemicals in general. And the filter paper and cotton wool can't be used for filtering these corrosive chemicals, right? Because they are affected by it. That is why we are going to use cotton wool for these purposes, unlike cotton and other materials. Although glass wool provides effective filter medium, but there are chances of contamination of filtrate with these glass fibers as well. How you observe the cotton fibers getting into the filtrate as such? You observe even here that glass fibers, whichever are present, or whichever this is glass wool is made up of, or the filtrate is made up of, they start entering into the filtrate. Okay, so this is a disadvantage with glass wool, even though they are much more effective in filtering the corrosive chemicals like acids and bases, but there are chances of these glass wool entering into the filtrate from this filter as such. Okay, moving on to others known as asbestos. So in general, asbestos is also used for filtering corrosive liquids, as in case of glass wool. Asbestos pads are prepared by compressing shredded asbestos. I'll show you how exactly the asbestos looks. Okay, so they have been prepared by compressing the asbestos, the shredded ones, and they have been tightly packed under pressure. So these pads have certain disadvantages, such like they impart alkalinity to the filtrate as such. So even though if your slurry which you're intending to filter, if at all if it's of acidic in nature, it will impart some sort of alkalinity, because the material whatever it is made up of, because of which it starts imparting or giving some alkalinity to the, or basicity to the filtrate as such. This is the main disadvantage. And certain substances like alkaloid substances, they get absorbed onto the surface of this asbestos as such. As well, this asbestos fiber may contaminate the filtrate. So this is the most common thing amongst all. So the best amongst all these is the this thing, that is stainless steel oven materials, whatever we said, where there is no fibers getting into the uh, filtrate as such. So other than asbestos, craft paper. So craft paper is almost same as that of whatever we use for binding purposes. Not exactly same, but it looks like that. So in general, they offer controlled porosity and limited absorption properties when compared to others, and it's quite cheaper in nature. Okay, so in industry, they this is the brown paper what you observe, but in industry they go for most commonly the white colored ones. Okay, so as well what they do is that, because it does not have so much tensile strength or mechanical strength as such, they go for uh, binding this with that. Binding in the sense, they'll have one more coating of cotton cloth or wire mesh over top of this, so that it gives sufficient tensile strength for this particular paper. So as such, only paper we are using, there are chances of breaking of this during filtration. Just to give mechanical strength, what do they do is that they give support of a cloth or a wire mesh on top of this, so that will be able to sustain for longer. So these are the some of the filter medias. Moving on to next, sintered glass. So this is nothing but the sintered glass. So this Pyrex glass powders are sifted to form granules, heated and fused to form such. You can observe here, this is nothing but the sintered glass inside whatever you observe. So for parentals and ophthalmic preparations, they are more preferred. That is where sterility is of utmost importance. Then it is good for corrosive liquids and oxidizing agent. For filtering corrosive and oxidizing agents, we are going to use this sintered glass. Not only that, they, as in case till now whatever we have heard, So they do not shed any fibers as such into the filter medium. That is why they are preferred in case of parenterals and ophthalmics. As well, they do not observe any liquids as such. Okay. So what do you mean by parenterals and ophthalmics? Anyone? What do you mean by parenterals? Anyone? What do you mean by parenterals?
No idea, ma'am.
No idea. Anybody else? No? Okay. Parenterals are the one. It's been derived from two words, para enterals. Okay. Para is nothing but other than. Enterals is nothing but the enteron. That is nothing but um, the mouth oral route. So other than that, that is nothing but these fluids, IV fluids, injections, all injectables come under parenterals. Okay. Parenterals are nothing but all injectables. That is, it could be intravenous or intramuscular injections. Totally injections comes under parenterals. Is it clear? So parenterals are nothing but those dosage form which are directly given to the bloodstream. Okay, they directly enter the blood. The injections, infusions, all this comes in parenterals. Okay. I think you don't have any idea about infusions. Infusions are the drips. You would have heard about drips, right? So drips in general we call it as infusions. Okay. Injections you commonly would have come across in injections based on different site wherever we are giving the injections. There are different types. Okay, like intravenous to the veins we are giving. Okay, intradermal to the skin we are giving. Then you have something known as subcutaneous. This is to the cutin part of the skin. Okay. Then we have, for example, you have intracranial, that is to the brain they are giving. Then there is something known as intradural, that is subdural, that is to the spinal cord. So like that, there are different regions wherever we are giving. So there are different names for the injections, but commonly in total we call them as parenterals. Okay, since directly they are entering into the blood, we have to take stringent care for parenterals, because we should make sure that they are free from microorganisms. Okay, these preparations should be free from microorganisms. In general, any dosage form should be free from microorganisms. However, we have to take utmost care when it comes to parenterals. There is some reason. The reason is that in case of parenteral, since it's directly entering into the blood, so it's almost like directly you are introducing microorganism into the blood. If at all, if the product or the whatever product we are taking, if it is contaminated with microorganisms, directly it will enter the blood. Say now the tablet whatever we are taking is contaminated with microorganisms. What happens is that there are different barriers the dosage form has to go through. Like for example, when we are taking the tablet, first and foremost it will come in contact with the saliva, right? Followed by that, we have lot many gut enzymes in the stomach. You have lot many acids also, HCl is there. So that would be reacting with those, and there are chances of sustainability. So probably the person would not suffer from disease in those cases, because we have various barriers in between before it shows some effect, right? So maybe by the end it might be inactive also, because it has to pass through all these regions. Whereas in case of parenterals, there is no other way. Directly we are introducing it into the bloodstream. There is no feedback mechanism there. There is no immunity uh, part there. Directly you observe that the microorganisms are entering into the blood, so there is no backup. Whereas in case of any other dosage form, there is something or the other that would be active there. For example, say now by chance you inhale dust. So how does our body react? By chance you inhale dust, how does our body react first? Anyone? By chance you inhale dust while cleaning or anything, so what's the first reaction our body does? Come on, speak up.
The
Itching.
sneezing.
Sorry, by sneezing, right? So this is nothing but one way of a response by our body to stimuli whatever is happening. So this is foreign to us. The dust whatever we have inhaled is foreign body to our body. So because of which it tries to throw away. So that is by means of sneezing, right? But when it comes to parenterals, if something is injected directly, our body does not throw it away because directly into the blood you are giving it. So it is directly taken by the blood. That is why parenteral formulation in general should be made sure that it is completely sterile. What do you mean by sterile? What do you mean by sterile?
Free from all the germs and viruses.
Right. So that's free from microorganisms in general, right? It could be anything, bacteria, fungi, virus, everything. So it should be free from those, because if at all if they are present even in minute quantity, directly you are giving entry into the body, right? Not only parenterals, there is one more preparation known as ophthalmics. What do you mean by ophthalmics?
It's related to eye
Right.
drugs.
So what would happen by chance? Just imagine that um, probably you just touch chili and without washing hands you touched your eyes. What would happen? You touched the chili hand, the same hand, without washing, you touched your eyes. What is the first reaction that will happen?
It starts burning, like
Right?
burning
First thing,
sensation.
yeah, you'll have burning sensation, irritation, redness, and moreover, you'll have tears in your eyes, right?
Yes,
So
ma'am.
these are the response by our body to whatever is happening. Okay, so even in this case, ophthalmic preparation, it should be free from microorganisms. Why? Because if at all direct access to the eyes, so certain cases even a person can lose the eyesight. Not only that, just imagine whatever preparations we are applying to the eye, if it has some particles in that. Okay, both parenterals and ophthalmics, it should be free from some particles. Particles could be anything, it could be drug as well. But if the size of the particle is quite larger, what happens is that in case of parenteral, you observe that through the injection, whenever you're giving, wherever injection is given, that particular region you see that there is redness. Okay, we call it as necrosis. You observe only in that particular place wherever injection is given, their redness and certain times blister formation, that is a bubble kind of thing, or it could be a blood clot in that particular region. You would have observed most of the time, most of you would have taken some of the other injections or vaccination, anything. So in the region of injection you observe these things. So that is because of particles, some particles getting aggregated there. So that's in parental preparations whatever we are making. So if at all if it has minute particles also, they will go and stay in the place wherever it's being injected. Same with ophthalmics, as you said, with chili as an example. um, if at all if any, say now you're taking any drops, eye drops, if you're applying, if the eye drops has some particles, same itching and irritation it will cause, right? So certain maximum cases it can lead to even loss of eyesight. I'll give an example where there could be death in case of parenteral preparation and loss of eyesight in case of ophthalmic preparation. In which bottles do you get this parenterals as well as ophthalmic preparations? What is the container used? Any preparations? It could be eye drops or when you say parenterals, any vials. So, what is the container material made up of used for these?
Plastic.
Plastic. Okay.
Glass.
Most of the time, glass. Most commonly, 90 to 95%, most of them are made up of glass, right? So just imagine that whenever they are preparing this, whenever they're filling these material into the glass containers, if at all if there is breakage of some glass, and just imagine very minute particle has entered the preparation. Okay, in both cases, parenterals also, ophthalmic preparations also. Okay, just imagine that there is
This conference will now be recorded.
okay, just imagine that uh, there is one or the other particle that has entered the ophthalmic preparations as well as parenterals. So what would happen? So because just imagine the particle is so small that it is not, you cannot observe through your eyes directly. So in that case, if at all, if it's injected directly into your bloodstream, what happens? The glass piece enters the body. So wherein directly into the bloodstream it is going. So there could be chances of cutting of veins, right, inside. So if at all, if veins get cut, what happens? It leads to bleeding and the person will die, right? So not only that, how about ophthalmic preparations? Same thing. Just imagine if at all, if by chance there is contamination, whatever you're applying onto the eye, there are chances of cuts that would be present on the eye. Even the veins and all would get cut on the eye, and a person can lose the eyesight, right? So that is why these preparations, whenever they are preparing, that is the manufacturing, every step it is made sure that it is free from certain materials, not only microorganisms as well as certain particle like this, right? Because the material whatever they are made up of, that itself get contaminated certain times. So it is been checked. There are various tests which they do so as to observe that is there any contamination of these. Okay, that was just an example. So in general, so moving on to this, so sintered glass is commonly used. So since there is no shedding of the particles or the fibers into the filtrate, so these are more preferred in case of um, ophthalmics and parenterals, right? So they can be easily washed and they can be used n number of times. So when compared to others, so sintered glass is being used for parenteral and ophthalmics. Not only sintered glass, you have one more known as membrane filters. So this is the assembly. So this is the filtrate collecting medium, and this is nothing but the assembly. So at the tip of this, you observe this is the inverted ones. So below you observe this particular chamber, and top of that we are going to add the membrane filter. So this is very common among the ultrafiltration methods. Ultrafiltration in the sense you get maximum filtration. Okay, so this is generally made up of, the membrane filter is made up of cellulose, polyvinyl chloride, nylon and other cellulosic derivatives, and they are rare, very fine, having very wide range of pore size, 8 micron to 0.2 micron, so almost of the size of the bacteria. So that's why this membrane filters is most commonly used in microbiological experiments. So because 0.2 micron size, in the sense it's almost, even bacteria gets filtered through this. Okay, hence it is most commonly used for parenteral and ophthalmic preparations. So what do they do is that they are going to keep this filter paper like this and they invert it like this. Now filter paper comes here and you're going to pour in the solution. So through this, upon this you're going to have some pressure. So because of the pressure, there will be increased filtration what you observe. So there is the filter, how it looks. This is the closed one. Once you are going to take it out and just add it, it looks like this. Okay, so membrane filters as well as this sintered glass filter are most commonly used for parenteral as well as ophthalmic preparations. But in general, in industry, they are going to use this membrane filter itself for um, filtration of parenteral products and ophthalmic. In industries, this is membrane filter itself they are going to use. Okay, not only this, since I was talking about parenteral and ophthalmics earlier, so to uh, do the testing whether it has some microorganisms or anything, they're going to use the same test. So they're going to check whether this particular paper whatever we are going to keep, what they do is that they just add this filter paper into some media in the sense, um, in common terms if I have to say, media is nothing but the nutrients which is being utilized by the bacteria to grow. Okay, what would be the general, now how we eat, like that bacteria also require some nutrients for their growth, right? So what do they do is that they just filter the material whatever has to be tested. Say now parental, they are going to filter it through this. So they are going to take out this and take out the filter paper like this. So this filter paper, they are going to keep it in a nutrient media. Okay, nutrient media. Say now, if this particular filter paper, if at all, if it contains some bacteria, what happens is that this bacteria, whatever are present in the filter paper, they will utilize the nutrients whatever we are going to give them, and they are going to grow. Because of growing, they will multiply. So when you check, you observe that there is growth of bacteria. If growth of bacteria is there, that means that whatever product we are using, it is contaminated with microorganisms. Is it clear? So this is one of the tests. It is not required here, but in general, this is how they are going to do it. Okay. So this is the membrane filter what they are going to use, and they are going to keep it and filter it. So most commonly used in microbiology, as well as to filter parenterals and ophthalmic preparations in case of industry. Is there any doubt till here? Anybody has any doubt?
No, ma'am.
Is it
No,
clear?
ma'am.
So there are certain advantages with this membrane filters. That is, bacteria are removed by sieving or in general filtration. Absorption of medicaments is very negligible. In every new operation, a new disc is used because there are chances of contamination if we are going to reuse the membrane, right? Earlier, whatever we talked about, it could be reused, but this membrane filter, whatever we are considering, cannot be reused because there are chances of contamination. So for every new time, new filter paper we are going to use. Filtration is quite rapid because, as I told, we are going to give pressure. So because of which there is increased in the filtration rate. Okay, previous class we have studied different factors affecting where pressure was one. So increase in pressure increases the filtration rate. So don't liberate any particles into the filtrate. So that is why membrane filtration is most commonly used for parenteral and ophthalmic preparations, because they do not give out or they do not shed any fibers as in case of others. So there are certain disadvantages, that fine pores may get clogged easily because the filter whatever we are telling, they are very fine pored ones. Very small pores are present. In there are chances that they may get clogged. What happens if they get clogged is that filtration rate might decrease. Nothing else would happen. Because of this clogging of these pores or filling of these pores by some material, what happens is that filtration rate might decrease. So that's why anyways we are giving pressure, because of which it is not a great concern. Then soluble in certain organic solution, this is a disadvantage, that this particular filter membrane whatever we are thinking of, it is soluble in some certain organic solutions. So if at all if we are intending of using some organic solutions, then we are not going with membrane filters, we are going with other filters. Okay, very brittle when dry. Okay, so generally before using they are going to wet it and then use it, because if at all if they are dry, there are chances of breaking of that. Very brittle in the sense very easily breakable they are. So it's made sure that they are not dry. Okay, these are advantage and disadvantage of membrane filters. Is it clear? Is it clear?
Yes, ma'am.
Okay, moving on
Yes,
to
ma'am.
next, filter aids. Any idea what do you mean by filter aids? What do you mean by filter aids? So till now we studied about what are the different filter medias we are going to use. So filter medias are the one which will help in filtration. So this, it's like it's in between the slurry and that of the filtrate, right? The media. So what do you mean by filter aid in the sense? Filter aids are the substances which will reduce the resistance of the filtrate to flow. So that is, it will help in keeping the
This conference will now be recorded.
so moving on to next, filter aids. So these are the substances which reduce the resistance of the filtrate to flow. That is, what happens is that they will make sure that filtration takes place in a much better way, and these filter aids are added on to the filter media whatever we are considering. Like for example, if you have filter paper, on top of filter paper we are going to add this filter aids. On adding this filter aid, it acts as a secondary filter media. Okay, filter media is there. Then filter media, we are going to add these materials because they will help in reducing the resistance of the filtrate in general. So it will flow easily, and there is effective filtration. That is what is our intention. Just to increase the filtration, better filtration, to get better filtration, we go for filter. Sorry, they are added at a concentration 0.1 to 0.5% just before filtration. Okay, so after adding this, just a coating of different materials, and anyways whenever we go for filtration, even the solids will go and settle over the surface of these. So it's like efficient filtration takes place. Okay, so whatever filter aids or material, whatever we are going to add on the surface of the filter media, so we expect certain features or characters. So ideal characters is that they should be chemically inert. As I said, they should not be reactive. If at all if they react, we cannot take them for filtration as such. Then they should have low specific gravity. They should be insoluble in the liquid to be filtrated. Say now if it is soluble, what happens is that they get dissolved, right? No use of using filtrates then. So whatever liquid or the slurry we are thinking of filtering, the liquid whatever we are considering, the whatever filter aids we are using, it should be insoluble in that particular liquid, and they form whatever we are going to use the filter aids, ultimately they should form a porous cake. Okay, so main intention of using this filter aid is that they will form a porous cake as such, that will increase the um, that will increase the filtration. That's the main intention. So the main objective is that uh, it forms porous open cake, so that there is a reduction in the resistance of the liquid to flow. Okay, so by which effective filtration takes place. It's the only motto of using filter aids as such. So it forms porous cake, and it's readily recoverable. That is, after filtration you can take up the filter aids back. Okay, and whatever filter aids we are using, it's free from impurities. I'll give some example of filter aids, better you'll understand then. Suitable particle size with irregular shape is being used, because irregular shape when you use, filtration is much better. Okay, and they remain suspended in the liquid, and whatever filter aids we are thinking of, they are free from moisture. So these are certain ideal characteristics we are expecting from a filter aids. So what are the different filter aid materials we are going to use? Like diatomaceous earth, okay, perlite, asbestos, cellulose, carbon in the sense you can expect activated charcoal, this talc, kaolin, all these are certain examples. So what do we do is that all of you are commonly amongst all this, you know this talc. Are you aware of what is talc? There is picture in the next slide as well. Okay, so this is nothing but an example of those whatever is been mentioned earlier. This is nothing but the first one is nothing but the diatomaceous earth. So first picture what you observe is nothing but of diatomaceous earth. Second picture is of that perlite. So this is nothing but diatomaceous earth. This is nothing but perlite. This is nothing but asbestos. This asbestos, if at all, if I have to tell you, you would have seen the roof earlier. Whatever roof used to come, the roof is made up of this material. Okay, the asbestos. Okay, I hope you know this. The roof, whatever earlier they used to use the roofs. So these roofs are made up of this asbestos. So this is nothing but cellulose, which is obtained from plants generally. So this is nothing but activated charcoal, which most of you would know. Activated charcoal, the difference between charcoal and activated charcoal is that activated charcoal, there is increased absorption. Absorption, when I say, it is surface phenomena. Only on the surface of this charcoal, any particle will go and adhere. Okay, so this is nothing but talc, this is nothing but kaolin. So all these are example of that filtrates. Okay, filtrate materials. So diatomaceous earth, perlite, asbestos, cellulose, in general I've given it as carbon, which is for activated charcoal. So chemically these are the ones. And advantages, they are in general, the diatomaceous earth, they are available in various size ranges and used for fine filtration whenever it is required. So what do they do is that to the filter paper, a, a thin layer of these, any of these material is given. Okay, a slight or a thin layer of these materials, any of these materials as given. So what happens is that they will increase the filtration just for this purpose. So what do they do is that on giving a layer of this, it tries to form much more better cake formation, and the cake so formed. Cakes, when I say, when you filter, solids will go and stay over the surface of the filter media, right? So the cake, whatever is formed, that will be more porous. So the porosity of this cake so formed will help in easier or faster filtration. So this is the idea of using different filter aids. Clear? So diatomaceous earth, that is widely available in different size range and used for fine filtration whenever it is required. So the main disadvantage is that it is slightly soluble in acids and alkali. Okay, diatomaceous earth. That is why it is not taken or not considered whenever we are using some acid or alkali for filtration. We are not going to use diatomaceous earth because it gets, if it gets solubilized, there is no use of using it, right? So it should be insoluble. So because it has solubility slightly also in acid and alkali, it is not used in case of whenever we have to filter some acid or alkali. Perlite, it is more soluble, hence amongst all this, these are not considered for filtration. Other than that, asbestos has a very good retention on coarse particle acids, but since again it is more soluble, we are not going for all these in common use. Most commonly we go for activated charcoal, talc, and this kaolin, kaolin. Kaolin is most commonly used because they are inert, and there is no solubility issues with that, as well as they are not soluble in water. You would have observed talc is normal talcum powder, what you use for face powders, all those. For example, just test it today only. Just in water, you just add this talc and check. What happens is that they are not even wetted by water. Okay, whatever talc we are thinking of, any material, the talcum powder, face powder, everything is made up of talc, a material. So that when you add it into water, it will just, it is not even wetted by water. So such material it is. So most commonly we are going to use talc and kaolin as filter aids, which will help in better retention of the particles as such, and better cake formation and much better filtration. Okay, so this is about the filter aids and different filter medias. Anybody has any doubt? Anybody has any doubt regarding anything, you can ask. Yes, anyone? No doubt?
No, ma'am.